Hello, everybody. This is Andrew Gums. This is our 51st episode of our podcast, Artificial Intelligence and Cybersurgery. This is the podcast for our journal, Artificial Intelligence Surgery, the first journal dedicated exclusively to artificial intelligence and surgery. My co-host, Professor Vincent Grasso, is actually at a wedding in Berlin this weekend, so he's not able to join us. But I nonetheless, he knows our next guest very well, so it'll actually be good for me to have a little time with Professor Pruszyński, Karol, on my own. So Karol, because it's so much easier to say his first name, is a professor of surgery at the University of Lublin, absolutely beautiful city in southeast Poland. I think that's correct. And also the vice dean of the medical faculty. So I'm so happy to have you. Finally, we had some difficulty getting this scheduled, but we finally made it happen. So Karol, please let our viewers know a little bit about why you became a surgeon, if you have any surgeons in your family, or any doctors, and then tell us a little bit about your beginnings before we find out more what you're doing currently.
Hi, Andrew. Cześć, as we usually say in Polish. It's such an honor to being part of your project and this podcast. So thank you so much for having me here. Yeah, the story with me joining surgery started when I was at the age of 5, actually, and was able to read the first, letters. And my mom just handed me a quite big piece of book and just said, "Yeah, just have a look at it." So, intuitively, I was looking for my surname because it was one of the only things I could be able to read out and spell. And I saw my surname and I saw a name Jan next to it, and I was like, "Who's that?" And he's like, "Oh, nice that you asked." So Professor Jan Pruszyński, he was a cardiothoracic surgeon. He was a general surgeon, the surgeon in chief during the Warsaw Uprising in 1994, 1944, during the Second World War. And actually, the past week we had some nice meeting with your colleagues from the States, from the Department of National Defense, because we're trying to somehow, getting prepared for any aggression from East. And actually, they were wearing those pins from Warsaw Uprising, and they all gave us one. So a very memorable and very emotional moment. So basically, I never met him because he died when I was like 6 or 7. But he was the one that showed me this traditional surgical path. When I read about his achievements, he was the first one in Poland to implement tricuspid and bicuspid valves in the 60s. So he was a military doctor, so he always followed this route of discipline, dedication, and with the same time with some having emotions with the values of tradition and history of Poland. So it somehow allowed me to maintain this, again, discipline and standardization of all the basic procedures in surgery when I started my training. So I'm attending general surgeon.
Well, hold on, Karol, because I have so many questions that is so fascinating. Are you related to this doctor in any way?
Yeah, he was my father's uncle, so it's
Oh,
we have the
amazing.
same blood. Yeah, yeah.
So oh, fantastic! I love that, and also, I majored in archaeology, so I think I love history. Can you tell us a little bit more about the Warsaw Uprising? I was surprised to hear. I didn't realize it was in 1944. I mean, as we know, the war was well underway. The war was winding down. Can you tell me a little bit more from your perspective about what the uprising meant and what it means in Poland for Polish people?
Yeah, very early. The war started the 1st September 1939, And very quickly, the Polish politicians were able to establish a underground sector of basically administration, and it was all located back in London. So all the main decisions concerning the army and our country was being done in the UK. But at the same time, Warsaw being the capital, the largest city, the offensive and the war was going on every single day. So we are known for our help to the Jewish community at that time as well. And it seems that throughout the years, just people needed something to show their dedication, their love, and their passion to the country. It was a massive wave of national and like community thrive to save the country, not from the foreign government in UK perspective, but from our ones that people just wanted to take things in their hands. And the discussion on the reason for uprising is very, I would say, controversial, because knowing the resources we had, which were very, very limited, many people just said from the very start, it's not gonna work out. We're not gonna succeed. Like, what is your actual plan? What are you trying to do? Are you trying to, take over the Russians? It's impossible. But it wasn't the case at the time. People being enslaved and being held, underground, being somehow demolished, not only physically but also emotionally by the suppressors. They needed to show their like last dance, I would say, of dedication and love to our country. So many, and it wasn't only the men, it was also the women, the children even. Which did a tremendous job in the underground. They were meant to be those centers of all the informations, and because they were little, they could actually get deep down in the sewers, in those old rat holes, and they were like big part of the information and communication underground. So it's definitely something truly special. There is one very good book from the international level, written by Norman Davis. So I recommend it very, very highly if anyone is interested in times of war, and especially the Warsaw Uprising. It was something that we as Poles are known for, that we're being very emotional, but we are being very traditional. We like to manifest our love to the country, and in that time when there were information about all those concentration camps and what happened in Katyn in Russia, where thousands of our elite officials and officers were shot in the back of the head and killed instantly. This is something that we wanted to show as a nation, as a community in Warsaw, that we won't stand down that easily.
Wow. Wow. I'm gonna have to read that book because, at least in the West, or I should say maybe in America, it's easier. Or at least I should just say my background. I obviously know very much about the French resistance. My great grandfather was an Italian partigiano. He was a member of the I would you could call it the Italian resistance. But I didn't know, and obviously I feel a little bit foolish not knowing this, that there was such a strong Polish resistance. Of course there is. So I'm definitely going to have to read that book, but we're going to have to get back to you. Otherwise, we can go on this for hours.
Yeah.
So you had a very mythic figure in your past, and which obviously inspired you also to become a surgeon yourself. So did you go to medical school in Lublin? Are you born in Lublin?
I was born like it's actually also quite funny in terms of war. I was born close to Oświęcim, Auschwitz, the city which had the largest concentration camp, but it's also a city known for a good ice hockey team and swimming, which is a tradition in our town. But now the thing is that my parents are also doctors. My mom is a pediatrician and my dad is an ONG. but they're both retired now. But they never forced me to go to medical school whatsoever. But you know, the feeling, this passion, hearing all those stories about war and all those surgical procedures being performed in the combat area in the field, it was just so inspiring that I always knew I wanted to join medical school and go for surgery residency if possible. So I joined Lublin because my mother's family was being raised there, and she finished the school in Lublin as well. And you know, it just happened to be that I landed there in 2008, and we have a 6-year program of medical school. So I graduated, instantly went for a so-called 1-year internship, where you have all those different rotations in different departments, from internal medicine up to psychiatry. And then I had a possibility to start my residency in general surgery, but at the Department of Surgical Oncology. So, apart from all those acute cases that you have at the beginning of your training, I was also being aware of this multimodal treatment of cancer patients from the early on. And it stays until now, particularly somewhere in my research focus. But along the way, I had a chance to visit a couple of nice places in Europe to look up the minimally invasive approach. So alongside with my colleagues from the department, we had the privilege to stay in Pampeluna for a couple of days to see this minimally invasive HPV surgery.
The running of the bulls? Were you there for that? No, isn't
It was just, but one of the major moments in my career was a 6-week research clerkship in the Erasmus Medical Center in Rotterdam, where I had the chance to meet Professor Bas Wijnhoven, who is a recognized upper GI surgeon. And you know, it clicked somehow immediately between us. So we also have some joint research projects until now concerning optimization of diagnostic and treatment of gastric cancer patients.
Oh, I've seen those publications
as well.
Yeah, beautiful.
Yeah, so Bas, being the editor of BJS, he's also like, and being a Dutchman, he's like very, very precise and very standardized, and it helped me to also somehow get into this proper research school, and methodology. And then just keeping it going, the one of the second, maybe even more impactful things was a visit to US last year for 6 months, where I got this scholarship from Polish National Agency for Academic Exchange. I came up with an idea of introducing the robotic surgery into our university. Even though we had this short summer romance with Versius system, with the CMR, so we performed over 50 procedures from colorectal up to some hernia repairs. But still, I believe that we still need to create and establish a program which would be dedicated not only to general surgeons, but also to gynecologists, urologists, and so on. Yeah. So hopefully this is, melody of the nearest months. But I went to the Ohio State University, where Professor Tim Pollock took nice care of me and was my research mentor for a couple of months. I was able to.
And he has Polish origins, of course. Has he come visit you in Poland yet?
Yeah, his grandfather was Polish. He never was in Poland yet, but. And this is also an invitation to you and all the viewers. Next year, 16-18 May, we have the annual Congress of Polish Society of Surgical Oncology here in Lublin. And I have this privilege to be co-organizer of this event. It's going to be held in a really lovely Congress Center in the downtown of Lublin. So feel free to join. It will be a privilege to have
remind me the dates. I'm making a folder for it right now.
16-18 May.
Okay, perfect.
You know.
Yeah.
So we're gonna have this, international discussion on, various cancer treatment, but not only. So if yeah, I'm gonna keep you updated with the event as well. So what I could see in the US was the complexity of your databases, like NCDB and all those, different mm, state data sets as well. But also, what kind of struck me was the establishment and the actual importance of the socioeconomic factors and how they can impact the actual, outcomes. So my first paper published in the US was actually on persistent poverty having a negative impact to access on minimally invasive HPB surgery. So we could show that within those counties where the poverty is being persistent for over the years, the access to robotic or laparoscopic, Whipple or some even minor liver resection is diminished. And I think that it's something that we should also focus on in the European region now, knowing that we have this new challenge of having immigrants from all over the world, this multicultural aspect. This is all really important. And as soon as we also have a look on it from the medical perspective, we will be able to help those patients knowing their also tradition and cultures, because it is actually much more different from ours. And at that point, I believe that there is a role to play in AI to find those digital pathways in between those things that they could that AI could actually help us to select those patients that could benefit from.
So that you're doing my job for me, Karol. You're bringing it
It's just
AI.
suggestions.
No. I'm kidding. But and I thank you. But I wanted to ask you before we get into that, and it is a perfect segue. Is in France, unlike the United States, they do this thing where they do not ask you what your ethnicity is. In America, whenever you take an exam, whenever you want to enter into the country, whenever you want to get a driver's license, whenever you want to get a bank loan, they always ask, are you white? Are you black? Are you Asian? Are you Hispanic? Are you other? Blah, 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 blah. And in France, they don't do that. And when I moved here, it took me a few months to understand that they didn't do that. I couldn't believe it. They just kept explaining to me, you are either French or you are not French. And I was like, what? But they don't look at this. And it is beautiful, especially from someone who is, of a mixed race, or even though, as Einstein, when they asked Einstein what his race was when he came into the United States, on the form he wrote human, of course. So I shouldn't even use that term. But I'm a multicultural background, however you want to say it. I was fascinated by this in France. But as you just said, there are things related to people's ethnicity. There are things related to their socioeconomic background. And I don't know the answer. In France, I find myself in a bit of a utopia where the concept of race doesn't even really exist, which I must tell you is the future and a beautiful thing. But as you know, as you said, and as you know, there are problems with different outcomes, and so there's no way of tracking that in France. So in Poland, do you look at ethnicity? Do you record that, or not?
Well, just coming back to France for a second, if I can, I read this nice article about the French soccer team, where obviously they are guys that have having successes starting from 1998 when they had their World Cup back in France, and this controversial final with Brazil though. But again, I totally agree with you that we should all not look at ourselves by terms of race, but at the same time we should still somehow respect the traditions. If there are majority of the soccer players from in the French team, and they're French obviously, but they do have some roots back in Senegal or other
Caribbean,
African countries. This
Yeah.
may relate, perhaps to their, I don't know, nutritional habits. And this again may influence the actual outcomes in surgery and oncology. So of course it has to be really delicate. It has to be two-way communication. But the thing is that from Polish perspective and what we're having here right now during the war, of course we do recognize Polish citizens and Ukrainians because we have to due to all those bad things that are ongoing, and somehow the government has to not maybe select or divide the citizens, but there are different resources being given to the Ukrainians that require our support as a country. And of course, we have our own national health fund, and they need to somehow manage it. So that's the only reason. But now we are having, being getting to become a more international, worldwide country. It seems that our industry is getting better back in Poland. We had a long run to catch up because of the communism, but right now we have plenty of students from Southern Africa studying nursery or physiotherapy or even medical faculty. And from my perspective, all I'm willing to say is I'll be super happy if one day they would all become Polish. But again, I know that the differences in tradition and history are so major, and that our society is still not well educated in that field, that we need some programs that somehow will aid us to understand each other. Because only when we will realize what our needs are and what we are capable of, only in that manner we can, follow one direction, whatever it will be.
Yeah, in America, they use AI to they used in the past, I'm sure they still do, to decide which people get loans, bank loans and what have you. And unfortunately the algorithm was very, very racist, like
I could imagine.
like it was it was ridiculous. And obviously we're working on ways to make it less racist. I think one of the best ways is to have programmers of different backgrounds, obviously, because there's a lot of things that, if certain people from certain backgrounds are going to have certain assumptions. So the only way to really get into the nitty-gritty is actually to have programmers there that can oversee it and can find these problems. And so it's going to be a very interesting couple of years as we evolve. But of course I'm confident that AI can overcome this. Now, one of the things that most interested me in your, you're very young and you have an incredibly illustrious career already. But one of the things that we really clicked on was your passion and interest in nutrition, and you've mentioned it a lot already. And we really, as we're applying now for a grant together for this Horizon grant, and Lublin is one of the centers that is one of our cooperating centers. But how do you see AI helping you choose what patients can tolerate what surgery, and what they need in their preoperative workup? How do you see AI impacting us? And what I mean by that is, are we going to need artificial intelligence, computer scientists in the Department of Surgery to help us develop these algorithms? Now you're in a position of power, more and more at the university. Is this type of thing you're going to advocate for? Are you going to send more surgical residents to get PhDs in artificial intelligence? How do you see that we can progress in surgery?
Yeah, thank you for this question, and Andrew, and remarking it. Actually, even right now, the students from our research circle are taking part of this Lublin Research Science Festival, and currently we are assessing the body composition, but maybe not in cancer patients, but in the young adolescents. But also it will relate to cancer. So what the hypothesis is that if we will examine, students from or pupils from the final year of primary and secondary school when in the school year started 2 weeks ago in Poland. And in May, they will have their final exams. So the hypothesis is that if we will be able to indicate a couple of pupils that their body composition is showing that the trend is kind of being negative towards some either obesity or maybe cachexia, as we know, bulimia and anorexia is a major problem in the youth. And taking into account the concept of prehabilitation, so indicating the need for proper nutrition, but also systematic physical activity and a bit of psychological counseling, or even talking with your parents or with your head teacher. The concept is that taking the second assessment somewhere in May or June and comparing it with the results of the final exams that will determine to which university you will go. This can be really impactful in terms of education. But at the same time, if we want to prevent colorectal cancer, if we want to recognize it at an early stage where just polypectomy will be enough to deal with it, we have to start educating youth from the early start and showing them this nice fancy in-body machine, and talking about AI to youth, which nowadays they're all just looking at the screen and TikTok and YouTube, and the culture changes. We need something that will kind of interest our young colleagues, and I believe that AI can conduct a nice stepwise approach and can aid in creation of those models from administrative perspective or clinical research in countries where the actual programs are not that yet well established, or where we don't have such staff capacity. If I only have 3 or 5 students to conduct the entire thing, examining the patients, talking with them, sending the emails, filling out the data sets in Excel or whatever, at some point they will get burned out. So I believe that those deep learning models, creating those algorithms, will kind of create those additional forces that will allow us to have greater data, because as we know, big numbers don't lie. If we will have a possibility to gain greater numbers, the sensitivity and specificity of our algorithms or calculators will be greater. It's just like this GIST calculator for whether the patient should receive some adjuvant Gleivec or not. Yeah. This is something that usually was not known until now, and right now, if you resect a GIST tumor, its size, its number of mitotic rates and the location, then immediately you can calculate the rate of recurrence. But it was created throughout many years, involving many different departments from all over the world. So we don't have that much time. I believe the resources, the ethics of research has changed a bit, and knowing that AI, if being treated appropriately, if we will spend appropriate amount of time with them so that the actual prompts will be logical and reasonable, I believe that we can get a nice and structured objective feedback from them early on, and that again could kick off to some another important aspect. So the general idea is that if plenty of cancer patients nowadays, speaking of usually the GI tract cancer patients, requires some neoadjuvant prior to surgery, this is a perfect time frame where we could actually also use it for the patient in terms of this prehab. So making sure that their nutrition is correct, the activity is physical activity is correct, and here AI can also aid us. It can create a model of proper exercises, knowing your comorbidities. You won't ask a patient who was suffering from a heart attack 10 years ago to lift up 80 kilos or chest press. So maybe in that field the AI will be more objective, more standardized, and more repeatable, I would say, in creating those algorithms and nutritional programs. Obviously, it all has to be consulted with the specialist, but when he will get the data in front of his eyes, the data that he doesn't have time to collect by himself, he will be able to interpret it and tailor it towards the patient.
Karol, that's a great ending. We have less than a minute here on our podcast, so I want to thank you so much. I look forward to working with you on this grant and on other projects in the future.